Hello, everybody, and welcome back to our final session. I think we've saved a real treat for last, and we're working on the connection now to the U.S. Surgeon General, Dr. Vivek Murthy. We expect him to be joining us shortly. While we have just a couple of minutes to wait on the Surgeon General, I'd just like to share a few of my closing thoughts about the conference today. First of all, we think this hybrid model has been just a roaring success. And thanks for all of the real-time feedback that many of you have given us to really inspire us and think about what comes next. Perhaps I'll set the stage a little bit by talking about where we have come since our last symposium to now. And it really, if you think about it, it's quite an impressive journey. For one thing, this week has really exceeded all of my expectations. I'm just blown away by the dramatic, inspiring, compelling information that we've heard from our speakers. Both keynote and the breakout sessions have all been exceptionally well received. And I know that many of these messages were really forward-thinking and hopeful. And so I'm leaving this conference today quite elevated and quite elated with where the future of total worker health lies. Many of the folks who have made all this happen are going to be joining you on stage at the end of the ceremony today, and I can't thank them enough for all of their major contributions to our effort. First of all, let me say thanks to my NIOSH co-chair, Adele Childress. Dr. Childress has been a staunch supporter of this effort from the very beginning, so thank you, Adele, for that leadership. Lee, Lily, Courtney, the whole team at the Center for Health Work and the Environment have been just exceptional partners throughout this process. We could not have done this blazing success of a conference without you. So just a quick snapshot on what's happened since the last symposium to give you an idea of our potential for the future. Since our last symposium, the Total Worker Health Centers of Excellence program has grown from 6 centers to 10. The NIOSH budget dedicated to total worker health has increased by more than 50%. We've doubled the size of our total worker health affiliate program. We now have 52 signed MOUs with affiliates around the nation. These are partnerships that cost no actual budget dollars to NIOSH, but they are invaluable in the reach and in the dissemination, and really serve as learning laboratories, applied total worker health in a number of different settings and organizations and nonprofits and government entities. Extremely valuable for us to have those relationships. We've published a textbook on total worker health since the last symposium. We have more than double the number of academic institutions that are providing certificate programs, degrees, professional education, certifications related to total worker health since the last symposium. And we have increased the mental health investment by NIOSH by more than $20 million, largely driven by the inspirational foundational principles of total worker health. Some of you may have heard that just this week, the House passed a bill that would give NIOSH an opportunity to further our research in workplace mental health at the tune of $10 million per year for the next 3 fiscal years. We're really excited to see where this bill goes in the Senate, and we're hopeful that the nation's attention on these important issues is keener and more focused than ever. We will rely on all of you to help move these priorities forward. But perhaps more importantly than where we've been since the last symposium is where we will go between now and the next one. Certainly, I feel more energized about this effort than ever before, and I hope you do as well. I hope you're more compelled and more determined to do more on behalf of workers in this nation. I hope you're inspired to act to improve the safety, health, and well-being opportunities that the most vulnerable workers struggle with each and every day. And knowing your professionalism and knowing your competence and your dedication to this space, I believe we're in good hands. I want you to know that NIOSH remains committed to this effort and to all of you. We're a relatively flat organization that's easy to access. And if there's anything I can do to connect you to parts of the Total Worker Health Program, to any of the other divisions within NIOSH, whether it be our Health Effects Lab, our Injury Center, our Workers' Compensation Center, our Motor Vehicle Safety Center, our Aging Center, our Future of Work Collaborative, any of those issues that appeal to you, as well as all of the traditional hazards and issues that we're facing. I want you to know that you can access NIOSH for those services and assistance. So let me check in with our team and see if we have the Surgeon General joining yet. Hello, welcome.
Hello, thank you so much for having me.
Absolutely, it's our pleasure to welcome you to our third International Symposium to Advance Total Worker Health. We're very, very pleased and honored to have you here. And just to give you a sense of our audience, these are really dedicated group of folks who are really workplace safety, health, and well-being professionals. And I know that's a group that you've worked closely with and find inspiring. So thank you so much for being here. For our audience, let me just introduce our guest today. It really is our extreme pleasure to have you. And we've saved, I think, the best for last for this conference. So a warm welcome. So Dr. Vivek Murthy was confirmed by the US Senate in March of 2021, served as the 21st Surgeon General of the United States, but also he previously served as the 19th Surgeon General as well. And that's a pretty rare feat to serve in this position for 2 administrations. I think it speaks to his vibrance and his passion for this work. As the nation's doctor, the Surgeon General's mission is to help lay the foundation, if you will, for a healthier country, relying on the best scientific information that's available to provide clear, consistent, equitable guidance and resources for all Americans. Vice Admiral, he also serves as the Vice Admiral of the U.S. Public Health Service Commission Corps. Many of you know the great work of the Commission Corps. It's 6,000 dedicated public health officers serving some of the most underserved and most vulnerable populations in our nation. So this is a very meaningful contribution led by the Surgeon General. He's the first Surgeon General of Indian descent, was raised in Miami, is a graduate of Harvard, the Yale School of Medicine, and the Yale School of Management. He's also recently launched a new podcast, and I would love to hear more about this if we have time today, House Calls with Dr. Murthy. So that's awesome. These are conversations really around the power of healing, perhaps a message that our country really needs to hear today. A renowned physician, research scientist, entrepreneur, author, and mango aficionado. Love it. He lives in DC with his wife, Dr. Alice Chin, and their 2 children. Dr. Murthy, welcome.
Thank you so much for that very kind introduction. I'm really glad to be here. And I just also, from the top, just want to give a special thanks to NIOSH and to CDC more broadly for this incredible partnership and help over the last year as we've worked together on some critical issues regarding the workforce and specifically workforce well-being. So thank you for everything that you've done for us.
Absolutely. Well, again, thank you for joining us. And I know you're interested in speaking to us a bit today on worker well-being. We know mental health has been a priority for you, both in this and the previous administration. So let me just open it up by saying, why this particular priority for our nation? Why do you see this as really critical for us to get right?
Well, this is a moment where, as a country, we have to understand, I think, what's happening to mental health of young people, of older people, and folks in between. And the data it tells a disturbing story, which is that we have more people struggling with anxiety and depression. We have just extraordinary high numbers of people who are saying that they are struggling with loneliness, isolation. We have suicide rates among young people that increased 57% in the decade prior to the pandemic. And all this is happening at a moment where care is just not as accessible as it should be. So, when I think you look at kids, for example, it takes young people 11 years on average from when they have symptoms, when they ultimately get care for their mental health. That's an extraordinarily unacceptably long period of time during which people are suffering. So you put all of this together, and it speaks to a broader mental health crisis that we're dealing with in this country. Now, this isn't going to be a surprise, I think, to many people who are listening, because if you look at your own lives and at the people around you, at your friends and family members, colleagues at work, and their children, you're likely hearing stories of people who are struggling and whose kids are struggling. You yourself may be having a tough time. And this is not altogether surprising, just given everything we've been through the last 3 years. But that shouldn't also obscure the fact that there were trends that were taking place before COVID-19, trends around technology, around work, around the nature of dialogue in society, which had contributed in many ways to the negative impacts on mental health. Now, where does a workplace come in? Well, we spend a good chunk of our lives in the workplace, perhaps up to half of our lives, waking hours, in fact. And for many people, the workplace is not just someplace you show up to and then you just forget about when you go home. The experiences we have at work impact how we are at home. And we all know this too, right? You have a bad day at work, and sometimes that can affect how you show up for your family. Maybe you're short-tempered that day with your family. Maybe you're less patient. Maybe you just have less energy to play with your kids that day. And so there's an interplay here. And this cuts against the old, I think, thinking, which said that, when you go to work, you check all your personal experiences, baggage, mood at the door. And when you leave work, you do the same thing, and just as human beings, this is not how we function. So if we recognize that reality, that work affects our mental health and affects how we are outside of work, then the question then becomes, can work actually, and can the workplace be a place that can support mental health and well-being? And the reason I think this is so important is not just for workers themselves, not just because it's important to do right by workers, but also because it turns out when people's mental health is strong, and when they are feeling good, they can actually do more for the workplace as well. It turns out their productivity, creativity is better. Turns out it's easier to retain people in the workforce when they're happier, which makes sense. But this is why there's a win-win when we focus on workplace well-being. And at a time when lots of folks are just really rethinking what they want out of life, coming out through this pandemic, and in particular asking what they really want out of the workplace and what they're willing to sacrifice for work, I think it's really important that workplaces double down on this focus on workplace mental health and well-being, because it's an investment that will pay off again for the individual and for the organization.
Love that message. I think it's going to really resonate with our audience here today. I know, sir, that your team has really been at the center of the COVID-19 pandemic, really helping Americans every day better understand and make it through, navigate this, and hopefully now move on beyond it as best we can. What should we be prioritizing as safety, human resources professionals, occupational health professionals to help our workers navigate this new normal that we find ourselves entering?
Yeah, I'm glad you asked, because I think if you're any organization right now, like in the country, and in particular, if you work in HR, you're probably feeling like everyone is just asking you to do more and more and more, right? That there's more on your plate, more responsibilities, more unfunded mandates, which is there's just more to do and not necessarily always more resources to do it with. So there are a few things that I want to say about this. One is that our overall goal is to make sure that mental health and well-being are accessible to every worker, regardless of where they are in the hierarchy, regardless of whether they're a frontline provider in a hospital, someone who's working the cash register in a grocery store, somebody who's working in terms of manual labor in a factory, as well as somebody who might be sitting behind a desk, and answering the telephone, or being a consultant, or serving in any other kind of role. So across the workforce, our goal is to make sure the well-being is within reach. But to do so is the responsibility of all of society. It doesn't fall in workplaces alone, and it can't. We need schools and educational institutions to play their part. We need government, certainly, to have policies to make treatment more accessible and that invest more in research and prevention programs. But workplaces are part of this broader puzzle and matrix, if you will. And if you recognize that the impact of workplace mental health and well-being accrues to the benefit of both workers and the organization, that means that focusing on mental health should not just be an HR priority, it should be an organizational priority, because it's strategic. And that means that organizational attention and resources should flow to support HR departments in doing that important work of supporting workers in their mental health. Look, one thing that I have found, and I know there've been a lot of conversations around what's happening with people, shifts in the workforce, of great resignation. I know the term quiet quitting has made its way into media stories a lot in the last couple of months. But when I talk to folks around the country, whether they're older or younger, they tell me a few things consistently that they want from work. They say that they want to feel safe in their workplace. And this might seem like an obvious one, but during the pandemic, 80% of healthcare workers were verbally or physically attacked during the pandemic. We also know that apart from that, there are many people who are experiencing discrimination and bullying and abuse in the workplace, right? So we shouldn't certainly take it for given that safety is is something that everyone feels, but safety is critical. The second thing that people often say they want is to feel valued in the workplace, to know that both they matter and that their work matters. And sometimes we assume in the workplace that people know how significant their work is or how connected it is to the mission. But I've realized, sometimes the hard way, over the years by not doing it well enough, that you've got to over communicate that. You've got to really help people understand that their work is appreciated. You have to create a culture of gratitude in the workplace, but you also have to help people see how their work connects to the mission of the organization. That doesn't mean that everybody has to be saving lives around the world. But for example, if you're cleaning floors in a school, you're providing an important service to kids. You're making sure that they can come to learn each and every day in a workplace that's clean and that's safe. And that's important for you to know that and to feel that connection to the mission. So that sort of sense that you are valued, that your work matters, is the second sort of a data point that I get often from folks. And the third need that I hear articulated often is that people want to feel supported. There are a lot of people who are, especially during the pandemic, who find themselves having to manage extraordinary demands outside the workplace, right? Whether that was sick relatives, whether it was worrying about how to keep their children safe during the pandemic, but whether it was dealing with their own health concerns. And this put a lot of strain on folks. And, when they had to do so without necessarily knowing or feeling that they had support in the workplace, both from leadership, but also from their colleagues, that made it all the tougher. But the flip is that when they knew they had support, it made all the difference in the world. And I'll just tell you briefly my own experience when I was a resident working at Brigham Women's Hospital, after medical school. We were working incredibly long hours, 80 hours, more than 80 hours a week often. Intense situations where you are often literally life and death situations. And there were times when there were far more patients to care for, far more complexity of illness, and we had the time or resources to deal with. In many ways, you can think of that and you think, gosh, that's a recipe for burnout. And there were people who struggled with burnout, during training. But one of the things that helped many of us stay afloat was that we knew that even as hard as things were, that the people around us, our fellow residents, our fellow doctors, the program administrators, they really had our back. They would show up to support us during difficult times. They would give us breaks when, whenever they could, whenever we needed it. They would show up with food. Often they would look for ways to make our lives a bit better and to help cover us if we had a family emergency. These small acts of kindness showed us that we had support, that we weren't there alone. And that made all the difference in the world. So, as challenging as this is, I feel like these needs, to know that, again, you're safe in your workplace, that your work is valued, and that you are supported, these are constants. And I think when we orient ourselves around meeting those needs, not just with money, not just with new programs, but by building a culture that ultimately provides that kind of support and that sort of sense of mission, it goes a long way to supporting workers as they contend with really challenging circumstances outside of work.
Yeah, absolutely. Thank you for bringing up the issue of burnout, especially in healthcare workers. I know this is a very important issue for your office, for your team. And we know that health workers, we're sort of in the eye of the storm. Many of them are genuinely struggling right now. And thanks so much for your focus and some of your recent work specifically on burnout prevention in healthcare workers. What would you like our audience to know more about this specific priority of your office?
Well, thanks for asking about it. This is the subject of health worker burnout it's a critical issue for our country. It's also one of great personal importance to me. This is the community that I worked in for years that I was very proud of during the pandemic to see nurses and doctors and public health workers and pharmacists and folks across the healthcare and public health system really stand up and often put themselves at risk in order to take care of folks who had COVID-19. And despite all of those sacrifices, we found that many of them were subject to attacks. Many of them didn't have the protections they needed at work. And their health took a toll, both their physical health and their mental health. And that is so sad and regrettable. But the reality is that the burnout rate among health workers was high even before the pandemic. And one of the reasons I issued a Surgeon General's advisory on health worker burnout is I wanted the country to know, the broader public outside the healthcare world, to know that this was a crisis and that it affected their lives. We are now hearing stories and more people who can't get an appointment with their primary care doctor because their primary care doctor retired, or they're having trouble getting timely care in a hospital because of workforce shortages there. And so this is not just about making sure there are folks in our hospitals to care for those who have COVID. It's about making sure that there's a workforce that can provide basic preventive care, like vaccines, that can provide emergency care when you get pneumonia or break a bone, and to make sure also that the critical work of public health, keeping us safe from future pandemics and outbreaks, making sure the water is clean and that our air is clean. This is critical work that has to continue, but it's at risk because of burnout. And the key thing that I'd want folks to remember about this is that all of us have actually something we can do to help address burnout among health workers. We know that healthcare systems can help create environments where health workers have greater access to mental health care and supports, and where they feel safe and supported in their environments. But we also know that some of the extraordinary administrative burden that is placed on our health workers, often as a result of prior authorization requirements and other duplicative administrative requirements that come from payers and sometimes from health systems themselves, that we need to address those and streamline those, because the time, there's studies that show us that primary care doctors are spending twice the amount of time in front of screens than they are with patients, even though they went into medicine to spend time with patients, and even though patients want to be spending more time with the people taking care of them. Yet more and more of our time is going to work that is less and less fulfilling for the provider and the patient. So those are roles we can play, but also just as individuals out there, just to know that the appreciation and gratitude that you show to health workers goes a long way. I know you might think that folks are thanking them all the time. We remember the images and the sounds of pots clanging, in the evenings every day in the early days of the pandemic in New York City and Italy, to show appreciation for health workers. But the sounds of those pots clanging has long faded, into the distance. And instead, what many health workers are experiencing are verbal attacks, even just for making scientific-based recommendations, about how to prevent COVID or the importance of getting vaccinated. So if you've got a health worker in your life, please just let them know that you see what they're doing, you appreciate their work, that you care about them. And that, alongside the policy and programmatic changes that we laid out, in the advisory that need to take place, our hope is that collectively these will help address this crisis of health worker burnout.
Thank you for that. I'd invite folks to link to the advisory on our own website, Total Worker Health. You'll absolutely be directed to a suite of resources from the Surgeon General's office. Let's stick to this theme of burnout just a little longer, thinking more about other occupations and industries beyond healthcare. Here I'm thinking essential workers, the frontline workers, those who couldn't oftentimes work from home. They were facing a number of risks as well and at high risk for burnout. What would you like this audience to know about that?
Well, I think it's a really important point, because health workers aren't the only ones who are struggling with burnout. Workers across the board, especially our frontline essential workers, who have had to really battle through the pandemic, at risk to themselves, delivering packages, making sure that people can get their groceries in stores, working in clinics and other settings around the country. I mean, these folks have taken on tremendous risks to make sure that our basic essential functions in society, from food to education to housing, continue. But I think a lot of that has taken a toll. And one interesting thing for people to know about the mental health impacts of pandemics and other tragedies is there's often a lag, between the immediate stressor, let's say a hurricane or a tornado, and when the mental health impacts show up. So we tend to, like after a hurricane, I think about Hurricane Andrew in 1992 in Florida that I lived through, as a high school student, that we tend to think, okay, well, after the last house is rebuilt and the last piece of debris is picked up, then the community has recovered. But it turns out that there's a whole other set of injuries that take place that can't be seen with the naked eye, that manifests in various ways, as depression, as anxiety, as PTSD, as burnout. And if we don't recognize them, we're not able to address them. And we might think, gosh, why are these people still not, getting their act together? Why do they still seem like something is off? Even though everything seems normal, after the sort of event has taken place, like the hurricane. That we start to understand why once we realize that the mental health impacts often lag. And that's true because, in the acute crisis, we're functioning, like in a state of adrenaline, really. Like, this is a immediate stress state. We're in our fight or flight state. We focus, immediately. That's what acute stress pushes us to do. And that can be very helpful. When that's chronic, that stress, and that feeling of safety or lack of safety persists, when we're not able to process and make sense of the toll that the events are taking on us, that's when we start to see other manifestations crop up. And that's what we have to keep an eye out for. So as we think about how to address burnout, it's important that we ensure that mental health resources are available to people. We sometimes assume that just because somebody has insurance that they can go see a mental health provider. It's just not the case for so many people who may have insurance coverage with networks that are really narrow, or sometimes what are called ghost networks, which means like on paper, you've got coverage, but when you actually look at who can provide care in your area, there may be no one or only one or two people, and wait times may be many months long. So making sure that mental health care is available to people who have insurance coverage, that they have supports, including sometimes even bringing the supports in-house to have counselors like we often do and need more of in schools. This can be immensely helpful. But one other thing I'd recommend, that and many things we have to keep an eye on when it comes to burnout, is to recognize that burnout is not it's not a pure mental health crisis. It's a workplace phenomenon, right? And so when you're working in an environment where you don't necessarily have a sense of connection to the mission, where you're being asked to do a lot more than you're able to do because of either time or the resources that you have, when you're working in an environment where you just don't have support either, where it's a toxic environment where you may be experiencing discrimination, or other forms, of distress, that all can lead to burnout. And that doesn't mean that you have a primary mental health problem. It means, again, that you're experiencing a product, of a workplace environment, which is unhealthy. And so, how I think the pandemic, for all of its ills and the tremendous cost that we have borne as a result of it, it's giving us an opportunity to rethink how we work and to ask the question, how can we design workplace environments that actually support and drive mental health and well-being? It can feel like a big undertaking, but the important thing that I like to remember is that small steps can make a big difference. When you create an environment where people feel more connected to each other and have a sense of community, that doesn't have to take any money at all, but it can make a big difference. When you create an environment where leadership actually leads by example in talking about the importance of mental health and emotional well-being, and talks and gathers input from workers and gives them a seat at the table, that makes a big difference. And of course, when you have support for people in terms of counselors and access to mental health care, that not only provides them with care when they need it, but it tells them, my workplace cares about me, cares about my overall health and well-being. So we have a lot of work to do, but I'm really encouraged by the conversations that we're having as a country around mental health. I feel I've never seen this degree of openness about addressing mental health, this degree of urgency that I feel from policymakers and parents and workers about addressing mental health. I just want to make sure we use this moment to make the changes in culture, programs, and policies that we need, because otherwise this moment will fade. This window of opportunity will close, and we'll be back to where we were prior to the pandemic.
Unfortunately, our time is getting short. We only have time for one more question. And you've talked to some of this already, but I'll give you just an opportunity to share any closing remarks. We know that the work experience really can be part of a fulfilling, meaningful life. And it's really central to so many levels of our nation's security, our personal and national prosperity. And I know you're optimistic about the future of our nation. So as we wrap up today, what words of hope or encouragement would you like to share with these dedicated professionals that we have here with us today?
Well, first of all, I'm just so grateful for the chance to have this conversation. 15, 20 years ago, I'm not sure that we would have been having a conversation like this, but we would have put so much emphasis on issues like burnout and so much of a focus on workplace well-being. But this is a sign of, I think, better times and greater openness. But in particular, I want to thank the folks who are attending this call today, who are members of and leaders of workplaces from all around the country. I would be remiss without recognizing that this has been an incredibly hard time for you as well. It wasn't like you were just sitting on the sidelines unaffected by the pandemic. For many of you, you may have gotten sick yourself. You may have had family members who struggled during the pandemic. You may have been going to work every day because folks depended on you, but in the back of your head, you were worried about your child who wasn't able to go to school or an elderly relative who was at risk. This took a real toll on everyone, including, I know, many of you. So the fact that you have come through and the fact that you are showing up today to not only ask, how can I do better for myself, but to really ask, how can I do better for my workplace? That's a testament to you, to your values, but it's also a reason why I feel so optimistic about the future, because we have folks like you, who are standing up and asking the question, how can we build the workplace of the future that's going to support the people in the workplace? It's going to do right by them, but also do right by the organization. And that is exactly the conversation we have to have today. One last thing I would just say is I know we've been talking about policies and programs, right? And that's a key part of what we have to change. But I also want to talk about culture for a moment, because we know that culture drives so much in society, including in workplaces, that we can have all the best value statements up on the walls and the best programs and policies that follow best practices. But if we don't have a culture that's right, that supports well-being, that supports a sense of community in the workplace, that values each person for who they are, regardless of their background, then we're not going to succeed in creating workplaces that truly produce healthy, happy, and productive workers. And so I think that broader question of culture is one that we have to ask ourselves about, and that we have to examine more deeply. And the culture is the most powerful thing that we can contribute to and create, but it's also one of the most challenging things to create, because you can't legislate culture, you can't mandate it. You have to lead by example. You have to actually live out the values that exist in your mission statement. And so as we close today, I just want to think about those values for a moment, because it's not just about the workplace, right? We look at the world around us, and I know many of us are worried. We're worried about the polarization that we see, the vitriol that we experience ourselves sometimes in dialogue online. We're worried about just the chaos and in some cases the catastrophe that we see reported in the news day after day. And if you're like me, a parent of 2 small children who's wondering what the future is going to look like for them, you may have dark moments where you wonder if there's hope. But the reason I think that there is hope is because the future is ultimately going to be driven by the values we choose to hold up and to live out. And the question for all of us is, what values do we want to anchor the future in? And I think that just regardless of the cultures that we come from or backgrounds we may have, regardless of what part of the country we work in or live in, many of us want a future that's informed by kindness, by compassion, by inclusion, and by love. That's what we want for our kids. I know when I can't, even though my wife has said accurately on many occasions that I'm an overprotective father, and I'm working on that. But despite that, I know there are going to be moments where in the future where I can't protect my children. I don't know what the kids are going to be like on the playground, how they're going to treat my children. When my kids grow up and are adults, are they going to be people who give them the benefit of the doubt when they mess up, who choose to look in their heart and see that their intentions were right, even though they may have said something the wrong way? Are there going to be folks who reach out when our kids fall down and help lift them up in those moments of pain? That depends on our values. the values that we choose to live out and lift up in the days ahead. And those are values that we can act on right now. So we don't need a law to be passed to change values in society. We don't need a major program to be put in place to underscore and strengthen the values that we want to live by. We can start ourselves with how we treat the people around us, with how we give people the benefit of the doubt when we don't understand what they're saying or disagree with them. We can start with what issues we choose to raise in the public square, what issues we choose to stand up for, and what people we choose to stand up for. Because the truth is that there are issues that will come up that may not affect us directly, but they may affect other people who may not have a voice. When we use our voice to stand up for them, and we're underscoring the kind of values that we want in society. Values, again, of compassion, of kindness, of inclusion, values where we recognize that we are truly dependent on one another, that we are not just all islands unto ourselves, but that, as Martin Luther King said, we are bound together, in a common cause and a common destiny. And so I hope that we will remember that as we go forward, because the future will be driven by and informed by the values we choose to live out and speak up for and enact in our workplaces and in our lives. And that is a place where all of us have agency and all of us have power. And that's what gives me hope for the future.
I don't think we could have had a more compelling message to end our conference with. So on behalf of CDC NIOSH, the total worker health movement that's sweeping the nation, and the more than 500 people who heard your remarks today as part of the conference, thank you so much for being with us.
Well, thank you so much. What a joy to be with you today. I so appreciate, again, your work and all the work of your colleagues at NIOSH and at CDC. Just very grateful for your partnership.
Right.
My gratitude.
Thanks very much.
Take care, everyone.
Bye-bye.